If you had to describe your career as a surgeon in one word, what would it be? For ACS President Barbara Bass, it would be privilege.
Lots of times when I'm in the operating room, I think, wow, what a privilege. What an amazing opportunity we have to help patients. You have to bring all of your wisdom, all of your skills, all of your everything, your compassion, your passion to do this right for that patient. That's a big deal. That's a rare privilege.
Dr. Bass acknowledges that privilege comes at a cost. Years of training, often postponing marriage and children, lost family time, enduring personal losses, sickness, and the list goes on.
I would say that one of the things we do reasonably badly is taking care of ourselves. But I think the good news is that actually all of our institutions now, those big players, are realizing that this phenomenon we call burnout is a function of that work environment. This is not signs of weakness in us. We are working in a really flawed working environment. We need to change those work environments in a positive way so that we don't feel that burden quite so hard.
As you might imagine, the words burnout and burden assume new meaning today than they did before Hurricane Harvey and the other hurricanes that followed. But the response to Hurricane Harvey, that of people stepping up and getting involved, is what can make a fundamental positive difference in virtually any time of discontent or hardship.
One of the things that always really surprises me is how well we can express our frustrations with our environments. And I think that's important to do on occasion. Venting is a really good thing to do. But in the end, we got to start banding together to create some solutions. At the national level, we have organizations like our American College of Surgeons.
Dr. Bass became a surgeon when few women chose surgery as a career. She was fortunate to have a few women to help her along the way. Kathy Anderson, Olga Jonassen, and Patricia Newman. Today, while the pathway for women in surgery is clearly easier, we are not there yet, she says.
We've come a long way in general surgery, where we now have about 40% of our incoming class are women. But if you look at things like cardiothoracic surgery or neurosurgery or orthopedics, we have a long way to go. We're getting there, but it's hard.
Dr. Bass may have chosen surgery when few women did, but today, as chair of the Department of Surgery at Methodist Hospital in Houston and executive director of Houston Methodist Institute for Technology, Innovation, and Education, or MITE, she understands that surgery does not stand still, and surgeons cannot either.
What's changed is our intersection between our hands and that patient, technology. So I really do believe that there is an important role for simulation-based education training in retooling surgeons. We have actually developed the network of centers that are capable of delivering this kind of training in our accredited education institutes. Medical schools are full. They don't have space for us. Teaching hospitals have their hands full. We need to have a special educational infrastructure committed to that physician in practice. And that's what MITE was conceived of. I think we've been successful. We've had over 45,000 people through for training in 6 years, including over 12,000 surgeons in practice.
Dr. Bass has a full life, a fulfilling life, both personally and professionally. A wonderful husband, her high school sweetheart, Richard, and her 2 sons, Wes and Wyatt, and a meaningful career. She believes the American College of Surgeons has also made a positive difference in her life.
Well, the college has really become kind of my professional home. It reminds you that we are a profession. As I say to my residents all the time, we're not surgeons because we want to be surgeons, we're surgeons because people need us to be surgeons. And this college kind of exemplifies that to me, reminds me of that. It resuscitates me. And I hope others feel that as well. I hope they feel that as well.